This video will describe the fourth oral health core clinical competency domain, communication and education. According to HRSA's white paper on the integration of oral health and primary care practice initiative, Domain 4 targets individuals or groups regarding the relationship between oral and systemic health, risk factors, the effect of nutrition on oral health, and preventive measures appropriate to mitigate risk. The primary competency for primary care providers in Domain 4 is to provide targeted patient education about the importance of oral health and how to maintain good oral health, which considers oral health literacy, nutrition, and the patient's perceived oral health barriers. There are a number of different opportunities to provide oral health education during a prenatal primary care visit. One is obviously during the prenatal visit itself through one-on-one communication between the primary care team member and the patient. The medical department can also have visual aids like posters and videos throughout the clinic, waiting room, and medical exam room. Another opportunity for education is take-home materials, which reinforces the education given during the actual visit. These include establishing self-management goals around oral health, pamphlets or brochures, and post-visit instructions that have information on oral health. This image shows how a medical department included dental instructions in their post-visit education. There are many great materials and resources for oral health education available online. This is an example of a poster that can be displayed in the medical clinic from the Colorado Department of Public Health Cavity 3 at 3 program. Oral health education can be given in other creative ways. Your clinic may consider giving oral health education in the medical department waiting room. This picture shows one health center that used their medical and dental assistant to provide educational activities and sessions in the waiting room around oral health. Oral health can also be incorporated into prenatal group education classes. Some considerations: one, at what visit will oral health education occur? To start, you can select one prenatal visit, then scale up later. Two, who will provide the oral health education? Your team may consider leveraging multiple team members to do this. Oral health education can be given not only by the primary care provider, but also by support staff like a medical assistant. Three, can oral health be included in the prenatal post-visit education? And four, are there other opportunities within your organization to provide oral health education like the waiting room or through group classes? This is a project measure for Domain 4. It is the percentage of pregnant women who received oral health education during pregnancy by a primary care team member. The denominator is the total number of pregnant women seen for a specific visit during the reporting month. The numerator is the number of pregnant women with documentation of oral health education during a specific visit by a primary care team member during the reporting month.